Hello everyone, welcome back to the Anatomy Lab. Today we are going to be taking a look at the humerus, which is going to be your first major upper extremity bone, which is going to be your arm bone. Now just to be clear, when I say the word arm bone, I mean that this is the upper arm region, which is between your shoulder and your elbow down here. So this is going to be surrounded by muscles such as the biceps brachii, the triceps brachii, the brachialis, and so on. But let's go ahead and start by taking a look at how this is going to be oriented in the body. So to get started, there's actually going to be one particular bone that it's connecting or articulating with, which is the scapula. And if you look closely, there's one big major landmark that is going to be able to connect to it, and that is going to be this big rounded side of the humerus. So this is actually the first thing that I look for on a humerus to make sure that I know what I'm talking about. If I find this big rounded ball end, there's only going to be two bones that it's going to be regarding, and in this case, it's definitely the humerus, because the femur, which we'll talk about later, has a long neck, but the humerus only has this very short anatomical neck. But with that said, you can see this very rounded side, and that is actually going to connect very well with this broad depression, which is called the glenoid cavity of the scapula. So you can see that it fits pretty well into it. This is going to be the head of the humerus, helping to form like the ball and socket joint of the shoulder. Now that's not all that we have here though. Like if you look closely, there's also a couple more bumps over here. So there's actually two bumps, mostly a smaller bump as well as a larger bump. So comparatively, we have small and large, and they'll be named that way as lesser and greater tubercle. So the lesser tubercle is going to be smaller, but also on the anterior side of the humerus. And then the greater tubercle is going to be larger and on the lateral side of the humerus. So remember, this was the head of the humerus that fits with the scapula. So this is going to be the medial side, which goes into the shoulder. This is going to be the lateral side that goes out. So looking at these two tubercles, though, we can now kind of like orient ourselves to the majority of this bone, being that this will be medial and lateral with head and greater tubercle. This is going to be anterior with lesser tubercle, and no lesser tubercle being posterior. But lastly, being that this is the shoulder joint, this is going to be the proximal side as well. So we actually have all of our orientation just by those few landmarks, but we can talk about like this bone a little, or the left and right sides a little bit later, but let's go ahead and keep going with our landmarks. So you have lesser and greater tubercle. And if you look closely from this different orientation, you can see that there's also this groove in the middle. This right here is called a sulcus or groove, but between the tubercles, this is called the intertubercular sulcus or intertubercular groove. So this is going to be right in between the two. So between, inter. Now, besides that though, there's also a couple of ridges or crests that go down from the tubercles as well. So once again, lesser tubercle, greater tubercle. This right here, this ridge is the crest of the lesser tubercle and the crest of the greater tubercle. Now, that's about it for the proximal side, but if we move down to like the diaphysis or the shaft of the bone, we'll be able to see that there are some bumpy regions. So if you look closely, there's going to be this bumpy region right over here on the lateral side of the humerus, kind of like a little bit to the side of the crest of the greater tubercle. This is called the deltoid tuberosity. So when you feel for like a general bumpy part or a tuberosity, it's usually a place where a muscle is going to attach. And if I said the word deltoid and that rung some bells, like that's probably because you know what the deltoid muscle is. Like it's the shoulder cap that fits right on top, but then it connects, or rather inserts, onto the deltoid tuberosity. But if we move a little bit to the back, we will like see this very faint line that is going to be slightly diagonal. Like this is going to be called the radial groove. So this one is actually probably one of the harder ones to find on some bones, but it is going to be a diagonal line, a very faint diagonal line, which is going to be where the radial nerve travels, and that is going to be right in the back and side of the humerus. So radial groove or radial line. Now, as we go down to the distal side of the bone, it looks a lot different. So no more ball end, unfortunately. It's a little bit weirder, but we can see that there's a variety of different bumps along the distal side. And this is going to be very crucial for forming like the elbow joint. So we haven't talked about it yet, but if you want to skip ahead, you'll know that there are two bones of the forearm. There is the radius and the ulna that will attach to these respective parts of the humerus. So the radius will be on the lateral side of the forearm, and that is where it's going to connect with the capitulum. So this big kind of rounded ball side, like this is mostly visible only from anterior. This is going to be the capitulum on the lateral side, but then you can also see that there's this hourglass shape with this groove down the middle. This is going to be called the trochlea, which is going to connect to the ulna. Now, based off of that, a couple more landmarks that we can look for is that there are a couple of fossae to look for. So fossa, just to remind ourselves, is going to be a depression of some kind. So usually a relatively broad depression, but there's going to be a few that we can look for relative to even these landmarks. So here's the here's the capitulum, which is going to connect with the radius. And if you go right above the capitulum, there's this little depression right at the top. This is called the radial fossa. But if you look at the trochlea, there's going to be a couple of fossae, one on the front and then a big one on the back. The trochlea is going to have the ulna, which is actually going to have like a hook shape, which is either going to be able to hook into the front or hook into the back. And depending on which landmark goes into it, this is going to be called the coronoid fossa on the front, and then on the back, olecranon fossa. So olecranon, if you're familiar, means like, or refers to the back of the elbow, and that's exactly where we are. So the olecranon fossa is in the back of the elbow, and it actually has the olecranon process of the ulna that goes into it. So coronoid fossa, olecranon fossa, and radial fossa. Now on the sides, you can also see that there are a couple of bumps over here. One on the medial side, which you can tell because of the head of the humerus, or one on the lateral side, which if you want to, opposite to the head of the humerus, or right next to the capitulum as well. So these two are actually called epicondyles because they are like above these bumps, which are technically condyles. So these are epicondyles. So depending on which side, medial or lateral, you will name them medial epicondyle or lateral epicondyle. And something that I would suggest is to feel the medial side of your elbow. Like go ahead and like feel the medial side of your elbow right over here, and you will be able to feel this big bump. That's this gigantic thing right here. That big bump is going to be your medial epicondyle sticking out from the medial side of your elbow. Now lastly, there are a couple of ridges that travel upward along these two medial epicondyles, two epicondyles, which will respectively be the medial supracondylar ridge or lateral supracondylar ridge. So supracondylar means like above the condyle, so lateral supracondylar ridge and medial supracondylar ridge. But with that said, I believe that's about it for today. So we will continue on to take a look at the radius and the ulna and all of their respective bony landmarks. But that's about it. So thank you for listening. Good luck with your studying, and I'll see you all next time.